Hey. Oh, Timothy in a month on. Yeah. So what I was saying about, because X-rays are, what do you call it? X-rays are, have the ability to cause cancer. We don't want to expose people too often or too frequently to X-rays. So for routine X-rays or for routine examinations, ideally, we don't want people to have X-rays more than once in every 6 months period. Unless, of course, it is very necessary. I mean, if the benefit outweighs the risk. So someone has some serious condition for which you are investigating and all that, you could do them. But if it's for routine, so for instance, someone is doing medical exams and has had an X-ray within the last 6 months, if there's nothing new or any problem that you are looking out for, there's no point in asking a person to go and repeat the X-ray again, which will expose the person to radiations. I hope that is clear. But of course, for even if the patient has done it and the situation warrants it, for instance, he had a chest X-ray done 3 days ago, but he has developed what's you could still go ahead and request it. Okay. Now the distance. Yeah, so you have this at the back of your mind when you request for patient. Yes. So now distance. So the distance of the patient from the X-ray source. All of these have been scientifically calculated and set up to ensure the safety of the client. All right. So there's they don't want the patients to be within a certain distance from the source of the radiation. All right. And the source or the distance of the patient is what they use to calculate the amount of radiation that can be let into the patient safely. Okay, so all of these are things that are factored in. And also shielding. So for instance, those who are working in the X-ray unit or where they take the X-ray, you realize that they would end up having been exposed to X-rays all the time throughout the day that they are at work. So if you enter in the unit, you realize that they have a shielding or a compartment where they can stay behind and the X-rays will not get to them, okay? And that is where the shielding comes in. So these shields are materials through which the strength of the X-rays will not allow it to penetrate, okay? And it could be like the what do you call it? The cement blocks or the building, the design of the building doesn't allow X-rays to come out through the walls, okay, and also through the doors. But for those who have to get close to the patient, there's a special garment that we wear, okay, that is like more like a bulletproof vest. The way it looks like, that's how it is. There's maybe longer to cover much more of the body to prevent radiation getting into the technician or the, like for instance, someone who cannot stand. If you need someone to come and hold the patient to stand for the X-ray to be done, then that person needs to be given a shield. Okay. So another problem or another thing that we need to take note of when we are dealing with X-rays are artifacts. Artifacts simply means or refers to things that you are seeing in the X-ray that are not on the individual or the patient that you are taking the X-ray through. And some of these can be quite serious in that artifacts have led to a number of big lawsuits and litigations where, for instance, they did an X-ray where they thought there was a metal or some metal piece in the person's body. They go and open up and it wasn't there. They later go and find out that in the X-ray room, there was a metallic device that was accidentally caught on the phone. That made it look like there was a device, a metallic substance in the place. So these are some of the artifacts we should be looking out for. And these artifacts can come about when the films are improperly handled. Okay, if you bend them or break them and all of that, you could start to see certain images develop on it. Okay? And sometimes errors while they are processing the films. And also sometimes when the patient is unable to stand still while the image is being taken, it might cause structures to be juxtaposed or make it look very, which may end up looking like fluid or some other substance, which is not there. Now, so motion artifacts. I'm just taking down a breakdown of motion some of the artifacts that we have commonly. So when the patient is moving, of course, that would be a motion artifact. So the patient will the image will become blurred, or you might see other things on the image which are non-existent. Okay. Now, sorry about that. Yes, so then the other one is image composition, or where you could have a twin or double exposure. So sometimes, depending on how the patient is positioned, you could have superimposition of two structures from different locations due to what they call a double exposure of the same form of plate. So for instance, the technician accidentally exposes or presses the shutter button, if I should put it that way, more than once on a particular image where the patient maybe is in motion. You realize that you have different structures appearing on the same film. But of course, most of our technicians are experienced, so these are not very common things that you find. But it's important for you to know so that just in case, for whatever strange reason, you end up with some of these images, you know what to do. In fact, I've seen some very, very bad x-rays before. You wonder who took them, but they do exist, even though they are rare. There are some facilities, looks like, I don't know what type of machines they're using, but some of their images are quite terrible. So it's important to know them. And then, of course, when the person might have had earrings or chains or things on which were not seen by the technician and the x-ray goes ahead, you see these things. And if the outline is clear for you to know that, oh, this is an earring, or this is whatever, beads or something, then you can know. But if the image is not so clear for you to know that this is an external object, then you begin to wonder whether there's something really in the person or not. Okay. Then also in the old types of X-ray machines that are used, sometimes even dust could collect in the film or in the structure in which the film is kept and might come out as artifacts, or they may show on the film and appear as artifacts. Okay, so this, for instance, X-ray here, that looks like there's a house flag inside here, okay? But it turns out that there was what do you call it, a metallic object that was left behind in the what do you call it, in the film, and it's making this up. So this, you see this X-ray and you wonder and wonder and wonder what at all is in this person's body, and you might end up asking the person to go and do a CT scan and all of that. But it turns out it is just an artifact. So these are important for us to know when we have these images. All right, so how do you view X-rays? So ideally, X-rays are supposed to be viewed or seen in viewing boxes. If you go to most consulting rooms, you'd find an image viewer or a viewing box. It's just a delineated box with light in it. So when you put your X-ray in and you put on the light, then you will better see the structures well. All right. Or in a dark room where you can have light in the background. So if you are in your consult room and you don't have a viewing box, you could, if the place is dark enough, you could just point let the X-ray face the light source and then you look from the other side so that you can see it well. It has the same effect as a viewing box. Then for the digital X-rays, of course, for them, you are seeing them either on a computer screen or something. And so the image, it doesn't really matter the area in which you are seeing it. You can still see your image clearly. All right. So as I mentioned earlier, the basic concepts in viewing X-rays has to do with the size. So you should have a fair idea the size of structures. For instance, if you are looking at an X-ray, you should have a fair idea of the size of the heart or the lungs, so that if the heart is looking too big, you will know that, hey, this is out of place. Okay. The usual shape of structures. For instance, if you are seeing a bone, you should know that bones are usually straight or look like this, so that if it's a cancer developing in there, where the shape is distorted, you can be able to tell. Also position. For instance, when you take an X-ray, you know that you should find the heart on the left. But if you are taking an X-ray and you are seeing the heart on the right, then you begin to wonder whether this is a case of dextrocardia or it's a case of wrong labeling. Okay? And then you should have a fair idea of the density of structures so that you'll be able to know, based on the appearance you are seeing on the X-ray, whether they are normal or not. Right. So what are some of the X-rays that we have? The common ones, the most common ones are plain X-rays, amongst which you'd have chest X-rays, kidney, ureter, bladder, or abdominal X-rays. Okay. And we'll look at a whole lot of applications for these ones. And the applications are what will guide you to be able to know when to use what and when not to use what. Then also we could have bone X-rays, which are used in, for instance, in trauma. Want to see whether there's a fracture to a bone or bending to a bone and all of that. You can, X-rays of bones can help you. Then there are other special X-rays, okay, such as barium. So for barium X-rays, okay, which are called contrast X-rays, you give a dye or you give a substance which is very radio opaque, okay, and you cause it to line to a structure, and then you shoot your X-rays and see how it looks like to be able to help you detect any defects or abnormal outlines to help make a diagnosis. So the most common ones we have are barium swallow and barium enema. Okay, barium swallow and barium enema. So we'll look at some of the applications for some of these in subsequent lectures. Then also mammogram. So mammograms are basically plain X-rays of the breast. And I'm sure you all know that we use mammograms to be able to, what do you call it? Detect, detect cancer. All right. Yes. Now, HSG, I'm sure you've done it in obs and gynae. HSG means hysterosalpingogram. So what they do is that they pass a dye through the vagina, through the cervix, into the uterus. And they hope to see this spill into the abdomen. So they pass the dye and take an X-ray and to see whether it passes through the tubes and all the way to determine whether the tubes are patent. And this is used in investigating infertility. So we'll look at them in brief shortly. Some of these also, like I said, come with reports. But it's just for us to have a fair understanding of what they are and how they operate. So we'll look at them in detail. So some of the common applications I've mentioned already are to include or exclude traumas, fractures when we are investigating trauma, assessments of joint or spine diseases, assessment of the heart and lung diseases, and also in looking out for foreign bodies. So these are things that we'll look at later. Now, some of the X-rays we know are contraindicated in pregnancy. However, and that is because the developing baby in the womb, you know, wherever you're having cells dividing at a higher rate, you have a higher risk of forming cancers. So babies in the womb are particularly at risk of developing cancer from X-rays. And so we avoid doing X-rays in pregnant women. However, if you must, by all means and at all costs, do x-rays, we can use shielding. That means that pregnancy is not an absolute contraindication for x-rays. However, it is contraindicated, but not an absolute contraindication because you can use shields. You can use shield to shield off the abdomen and the uterus so that it doesn't come into contact with the x-rays. For instance, if you need a chest x-ray or leg x-ray or hand x-ray, you know, in a pregnant woman, then you use the shield to shield off those areas, the uterus, so that the baby doesn't come into contact with that. So basically that brings us to the end of this introduction to diagnostic imaging and x-rays. So we'll take any questions here quickly before we bring it to an end.
Hello, sir.
Yeah.
Yeah, please, when you have overexposure, is there any medication that can reverse any potential risks? And also the last one is, what's the half-life for radiation for the one that is being absorbed, the X-ray that being absorbed in the body? For the one that is being, that pass through there is okay, but the one that being absorbed, what's the half-life for it to decay?
All right, so they for x-rays, they are not the typical radioactive material that we know of. So we don't talk about half-life when it comes to x-rays, okay? And so we are not so worried about it being absorbed in the body. We are talking, so that means that once we are out of the range of the x-rays, that does it, all right? And so we are not so worried about the person has absorbed too much x-ray or not. Okay, what we are worried about at the point when it is passing through, at that very moment, that is when it has the potential to knock off, atoms and the rest, and so cause some defects in the genetic material, especially in structures that are rapidly dividing. Okay, so this is not like the typical radionuclide elements that are used in brachytherapy and the rest. That will be given off radioactive material. No, that doesn't apply with x-rays. So we don't talk about x-rays. When someone has overexposure, there's nothing you do about it. The rays have already passed and gone. So if there's been any damage, it would have been done already.
Okay, thank you.
Any other?
Hello.
Okay, so if there are no questions.
Hello, sir. Yeah, please, sir. This one is for the slides.
Mm-hmm.
The slides, we still haven't received about 2 slides from the ophthalmology and this one too. So if you can, please.
Because I've handed over every slide that we've done. So I don't know which one. Which one is it?
The refractive error and one, I can't remember one, two. We didn't get a slide.
Is this class red talking?
No, please.
The last two lectures we have not received. The refractive index. Yes, sir.
I see. Oh, I'll see if I can find. Last I said I lost my laptop and most of my stuff. So, but I'll see if I can find that one. So which one? Yes, but I don't even know which one is missing. So
the conjunctivitis, and the refractive.
Conjunctivitis.
Conjunctivitis.
Abutre.
Munim ya kamfa musre. Ye bisa mutiti.
Abutre.
All right, so end it here. Looking at the time that we have left, we'll be doing a lot of.
Hello, sir. Hello, sir.
Yes.
Hello.
Yes.
Yeah, so I wanted to know if, with emphasis to TB, tuberculosis, yeah, I want to know if there's a way that imaging alone can be used to conclude on a diagnosis. I happen to work in the DOT center, and there are some instances that sputum will be negative, but clinicians will request for chest X-ray, and they will examine the chest X-ray and might say we should put the patient on TB medications. So I wanted to know if in those instances, the imaging results alone is a conclusive investigation.
I would say no, because you would still need to marry it with a clinical picture of the person. So someone who has, in Ghana, anybody who has a cough for more than 2 weeks is a TB suspect, right?
Yeah, sure.
So including the symptoms that maybe the person is coughing, has weight loss, has night sweats. So in that case, any features of pneumonia may point or may be suggestive to the clinical symptoms will be suggestive of TB. And also remember that TB has a criteria, WHO criteria for diagnosis, and X-ray findings are one of them. So there are certain things that when you see on a chest X-ray, you are more likely to think towards TB if certain signs and symptoms are present.
Okay.
TB has affinity for the apical regions of the lungs. I don't know if you're aware.
Yes.
So if you are seeing, and normal pneumonia is usually in the lower, the lower lung zones. So if you are seeing someone who is coughing has come to you and the pneumonia or the consolidation is more in the apices of the lung, then you know that this is likely to be tuberculosis. So those are some of the ways by which we're able to tell. But clinical signs and symptoms play a key and major role in the diagnosis. So somebody will be there not having symptoms. Rarely would we say the person has TB, unless maybe the person has cancer, which is here to start developing symptoms. So basically that.
Thank you very much.
Hello, Doc.
Yes.
Yeah, so we received 2 slides from you, anatomy of the eye and then eyelid and conjunctiva. These are the 2 slides we have from you.
So which ones are left? I need to know which ones are standing, then I'll send those ones to you. You mentioned conjunctivitis, so which one again?
Refractive error.
Refractive errors.
Refractive errors and conjunctivitis.
Yes, sir.
Okay, all right. All right, so end it here. Typically, let's consider Monday, Wednesday, Friday, Saturday, and Sunday. So tomorrow to meet, tomorrow afternoon.
All right, Doc.
Monday evening, Wednesday evening, Friday evening, Saturday, and Sunday. All right. So then, so 38 of you were present. Come in, let's get my attendance. Okay. All right. Okay. So I'll finish. So we can end here and then continue tomorrow.
All right, Doc. Thank you.